Thank you, Mrs Moon. It's a pleasure to serve with you as the chair, and I'd like to congratulate my more friend for making such a powerful opening to this debate. I want to talk about primary care in Plymouth because I'm very worried that the crisis that we have in primary care in Plymouth is at risk of getting much worse in the coming months as GPs are considering where to hand back their contracts in the next couple of days. A lot has been done in Plymouth to integrate our healthcare system and our social care system. Sometimes our distance away from London has meant that we've managed to avoid the headlines on it, but not the hard work. And there's been a huge amount of effort in innovation and integration that's taken place in the West Country, merging social care, mental health provision and our acute hospital trust together. And an enormous amount of thanks and credit should go to the hard-working staff who have pioneered that, along with the City Council and other providers. But there is a problem with primary care in particular. Now, this is exacerbated by other parts of the system that doesn't seem to work, as my friend from Stroud has just said. But there does seem to be a real crisis in primary care at the moment that needs to be addressed. I welcome the news that was given by Simon Stevens on his visit to Plymouth last week that we'll get an additional 12 extra training places for our university to train GPs. But there's a real crisis today, and I think I'm looking for actions from the Minister to assist us in being able to support that crisis today. Nurse and GP vacancies persist in Plymouth primary care sector and waiting lists continue to be high. It's important to say that this is not because the superb staff in our NHS are not working their socks off, because they really are. There's a persistent underfunding of not only general practice, but also the wider sector. NHS England estimate that 1 in 7 GP posts in Plymouth have not been filled, which is an alarming statistic. I've heard of one GP surgery not far from in the heart of City that's been advertising for a GP vacancy for a year, and they've had no applications so far. So there is a... happy to.
Way, and I have similar issues in Melksham within my constituency. Is the honourable member aware of the targeted enhanced recruitment scheme, which offers £20,000 to attract trainees in areas that have for a number of years failed to fill those places, which is available in Swindon in Wiltshire but also in Plymouth?
I thank the member for that intervention. I think the problem at the moment is those schemes that currently exist are not working. They're not working to effect that we need them to in Plymouth, because we have a crisis today on this one. So I want to go on to talk about the concern that a lot of the GPs have expressed to me. Now, my remarks are going to be about what GPs have told me rather than my analysis of what I believe the GPs are saying, because I think it's important their voice is heard in this debate. And one of the questions that I have for the Minister is whether he will meet those GPs to raise, so they can raise their concerns in person, because there's a number of GPs that have solutions or have suggestions for what can be done. At the moment in Plymouth, each GP has around 2,364 patients. As we heard earlier, the average is just about 1,700. So there's a greater demand on what we've got. One GP told me last night, they've just walked through the door after a day where I saw my first patient at 8:25 in the morning and left my last patient's house at 8:15 in the evening. This is because district nursing services are currently reliable, though it's no fault of their own. They'll go back to the patient's house at 8 o'clock tomorrow morning because the patient's housebound and needs blood tests. He went on to say a large part of pressure on GPs is the fact that other community services had such drastic cutbacks. I feel very lucky, he said, very lucky to have secured a well-paid, fascinating, rewarding job, but it's a little overwhelming when I constantly worry that just one major problem will mean that things become very, very unsafe. I'm going to continue if I can, apologies. Another GP, Dr. Williams, said, the system is failing and it feels like this may be intentional. They've heard that there's concerns that they've heard NHS England say that they're watching Plymouth as a place that primary care could fall over. And that is a sentiment that a number of GPs have expressed to me in private, that they believe that Plymouth as a citywide system is facing a bigger concern from primary care. And that's one of the reasons why a meeting for the Minister to reassure those GPs that the Department for Health and NHS England are on top of this is so vital. Another inner city GP said, I became a GP to help people with physical and emotional health difficulties, and this job I have really enjoyed for a number of years. During this time, patient needs and demand on general practice has increased significantly, but unfortunately funding has not always kept pace. We only get £115 per patient per year to provide the totality of patient care support, so it's no surprise we're struggling when some patients consult with us at least once a week. The GMS contract has between £73 and £117 per patient. But as we've seen in Plymouth, where GP surgeries have fallen over and emergency providers have been brought in, that can be as much as £347 per patient under the emergency access contracts. And there does seem to be a huge financial gap there that could be moderated in a way of supporting GPs, not to give them more money themselves, but to help them provide the support and assistance, not only through hiring more GPs and more support, but for the other professions that make a real successful GP practice. Very worrying, this doctor said, "I no longer enjoy being an NHS GP because I cannot keep pace with the demand, and I know our patients are getting frustrated with restricted access to their GP. Patients are complaining, and rightly so, but those complaints just compound my loss of joy from the job because I work harder and harder to try and provide the service patients want, but the majority of the feedback we get is negative." And that is something that's been echoed by a number of GPs in Plymouth who really want to inject that joy and passion back into their role. They entered this profession not because it was easy, because it was hard and difficult, but their efforts would make a huge difference to their communities. I'm going to continue if I can. Thank you. I'm genuinely worried that Plymouth's primary care crisis is going to get worse in the coming days. We know that there are GPs at the moment who are considering whether to renew or to hand back their GP contract, a decision that we made in the next couple of days. And that is deeply worrying, not only for them, but potentially for patients as well. My GP surgery in Plymouth closed recently, so I know what it's like to lose my GP. And at the moment, I'm especially concerned about those people who don't re-register with a new GP, effectively becoming an unregistered cohort of people in the city that then can only rely on acute A&E services. And our staff at Derriford A&E in the emergency department do an absolutely fantastic job, but they can't keep going if there's continued crisis. Plymouth Herald report that a third of GP surgeries are at risk of closure as the vacancies in primary care escalate. So can I ask the Minister, in conclusion, whether he will meet with Plymouth GPs so they can raise these concerns directly to him? Because I think there is an opportunity to avert this crisis getting any worse through proactive measures. What I don't want to see is this crisis getting worse and then more emergency access having to be put in as GPs who have worked beyond the point of exhaustion hand back their contracts. That is a decision that I can well justify with the pressure on them and their families, but it is a situation that we can avert if we take action today. So I'd be grateful if the Minister could address that in his concluding remarks.